Hi, everyone. I'm Amy Allen, Vice President at the Westchester County Association. Thank you for joining us in another in our series of online video chats where we bring in subject matter experts to share their knowledge and their insights about issues relating to the current COVID-19 crisis and beyond. And before I introduce our guest today, I would just like to take the moment to thank our WCA Platinum partners, without whose support we could not bring you this programming. Today I'm pleased to welcome Bill Hammond, who is the Director of Health Policy at the Empire Center, an Albany-based independent think tank that focuses on public policy issues relating to New York State. And Bill's charge is to follow the fast-moving developments in our healthcare sector, and certainly no sector is moving faster at the moment than that. And anytime we talk about healthcare, obviously I want to just take a moment to publicly thank and give our debt of gratitude to all of the frontline healthcare workers who put their lives on the line to save ours. So please join me in welcoming Bill Hammond.
Thank you, Amy. It's a pleasure to be here.
Great. So, Bill, I know you've been following what's going on in the healthcare industry, what's going on relative to the current COVID-19 crisis. So I wonder if you could just kind of paint a little picture as to an overview of what you've been seeing.
Well, I think we should start by acknowledging that the New York City metro area is suffering a lot worse from this than almost anywhere in the world. It's the hardest hit part of New York State, which is the hardest hit state in the United States, which has the highest number of infections and deaths of any country. As of Sunday, Westchester alone had almost 24,000 residents who had tested positive, and 743 of those had passed away. If this shows the number of the mortality rate adjusted for population for various counties, and you can see Westchester is there with the 7th highest rate. It's actually just a little bit ahead of Manhattan. New York City's really seen the worst of it, but the surrounding counties have also been very hard hit compared to the rest of the state and the rest of the world. I think actually the disparity is so striking that I think not only should there be a really thorough investigation of what went wrong in New York City, but I think it's actually something that epidemiologists around the world will be studying for years to come.
Yeah, for sure. There's going to be a lot of research that's going to come out of this. Now, clearly, this pandemic crisis has wreaked havoc on the finances throughout the state. I know the state did pass a budget on April 1st that had certain assumptions in it relating to healthcare and other expenditures. How realistic is that, and what do you see as some of the key components?
Well, they're operating, to be fair to them, they were operating really with a lot of unknowns and a lot of uncertainty. Only just recently have hard numbers about the economy started to come out. One survey by the Federal Reserve for Metro New York and Northern New Jersey found that 60% of service firms and more than half of manufacturers had reported at least a partial shutdown, and half of them reported that they had lowered employment in early April, and they had cut by an average of 21% of their employees and 15% of staff hours. My colleague, E.J. McMahon, who's been following this for a long time and is not prone to exaggeration, has said this is the darkest outlook for the state's finances since the Great Depression. So it's worse than the Great Recession of 2008 and 2009. It's worse than 9/11.
Wow.
The budget director, I think this has to be considered tentative, but the budget director, Robert Mujica for the state, has said that they anticipate that revenues will be $10 to $15 billion less than they had previously projected, which translates to about 10 to 15% less money for the state to work with.
All right. Wow. Now, I know leading up to the budget process, before we were dealing with all of the issues relating to COVID-19, there was a lot of discussion about Medicaid. Obviously, there was anywhere from a $4 to $6 billion deficit before the crisis, and I know the governor convened the Medicaid redesign team 2.0 to try and find $2.5 billion in savings, which I guess they did make some recommendations, which did make it into the budget. Can you share maybe what some of those are, and will they go through given what the hospitals are facing currently?
So the Medicaid redesign team, it's a group of representatives from the healthcare industry, but also from the legislature and from state government. They had a series of meetings in February and March, and with a lot of input from the Cuomo administration, they came up with a list of, their target was to find $2.5 billion in savings. And to put that in context, that's about 10% of what the state spends, it was expecting to spend on Medicaid. But to put it in further context, that also happens to be the amount that state spending on Medicaid was expected to increase from 2020 to 2021. So what they were really trying to do was put the brakes on a very rapid rate of growth of state Medicaid spending. They came up with a long list of recommendations. A lot of them focused on long-term care. That was the single biggest area that they reduced spending. And in particular, they focused on home-based long-term care. So services that are provided in people's residences by visiting nurses and visiting care aides. And even within that, they focused on the non-medical part of that. It's called personal assistance. And it's usually people without a lot of training who are low paid. They go into people's homes and help them with their getting dressed and cooking and cleaning and shopping. This is a really invaluable service that a lot of people receive, but New York spends much, much more on it than any other state. These are the numbers in billions that where is it? Crap. Are you hearing me at all? No.
We can hear you now.
Okay. Sorry about that. In 2016, New York accounted for 40% of nationwide spending on this benefit. Since then, New York's spending on the benefit has doubled. So that area of Medicaid spending was really spiraling in an unexpected and uncontrolled way. And that's a lot of where the Medicaid redesign team focused. They also did just across the board cuts. They touched hospitals. They touched Medicaid managed care plans. They took a little piece of money out of transportation and pharmacy. They came up with a total of $2.2 billion in recommendations. Most of them were included in the budget in some form or another, but not all of them will take effect right away for reasons we'll discuss in a moment.
Yeah. Before I forget, if anybody watching has any questions for Bill, please feel free to put them in your comment section, and we will get to them during the show. So thank you. So Bill, talk about, I know obviously today front and center is a lot of what's happening at the federal government. I guess the House is expected to pass the next stimulus round. How, in your opinion, has New York gotten its fair share, and especially from the healthcare side? And I know we're still waiting for some relief for the municipalities. Can you talk a little bit about that?
There have been 4 rounds of federal legislation meant to respond to this crisis and stimulate the economy, or at least prevent the economy from going into a tailspin. They've kind of escalated in size. The first one was worth about. All right, I've lost my place. The first one was about $8 billion. The second one was about $100 billion. And then the third one was $2 trillion. Most of that money was directed either to businesses in the form of loans and grants, or straight to kind of citizens. So there's a big increase in unemployment benefits and other interventions like that, where the federal government's directly financing various businesses and individuals. There was one area where they directed money to the states. It was called the Coronavirus Relief Fund. It was $150 billion nationwide. But and it was supposed to be to pay for emergency expenses related to the crisis. But they distributed it according to population and not according. They said that every state should have at least a minimum amount. And the result was that if you look at it according to how many dollars per diagnosed case, New York got the least amount of money of any state. So New York is way over on the right-hand side of this chart. They got $40,000 per case, whereas Wyoming, which has had very little of the virus so far, got $4.2 million per case. Now that adds up. When you multiply New York's share by the number of cases it has, it comes out to about $7 billion, which is nothing to sneeze at. Some of that has to be shared with local government. So you're talking about $5 billion for the state, which it can use for coronavirus crisis-related expenses. But again, the state has a deficit of about $10 billion, and not all of that's going to be coronavirus related. So it didn't completely solve New York's problem. It certainly didn't balance the budget, and that's why the governor is kind of continuing to hammer away, looking for direct relief to the state. Even as we speak, they're preparing to pass a fourth stimulus bill, which has some funding for New York and New York's hospitals. And there's talk about a fifth one. And that's really, Cuomo, I believe, is now focused on getting as much relief from the federal government in that fifth bill as he can.
Now, I think I saw something from the Healthcare Association of New York State, Haney's, where there'll be $75 billion included in this, I guess, fourth round that's going to be passed today. Now, I don't know. Hopefully, some of that will obviously, New York will hopefully get a fairer share of that. But I guess that remains to be seen.
That 75 was kind of an umbrella amount that's going to coronavirus emergency public health type expenditures. Some of it's going directly to hospitals and healthcare providers. Some of it is going to states. And a portion of the money that's going to states is going to be allocated according to need. So to that extent, they are starting to acknowledge that this public health crisis is much worse in some states, and in particular in New York, than other parts of the country.
Well, that's good to see. And I guess we don't know anything about when the next round might be forthcoming. And as you noted, and we've heard in the media, I know the governor, and I guess other governors as well, are really hoping there's going to be some monies to help solve some of these budget problems.
Yeah, we were talking before about the state budget. The state budget actually, on paper, what it says is that the state will spend about 2% more than it spent last year. So it's kind of a business as usual budget. It did include those cost-cutting measures in Medicaid, but those were addressing a deficit that existed before coronavirus. But it has a big asterisk on it, which is it has language in it that says if the state doesn't get a significant bailout from the federal government, the Cuomo administration is authorized to cut spending kind of across the board by $10 billion. He's kind of indicated that the first place he's going to have to cut is school aid, because he's already kind of taken a whack at Medicaid, and he doesn't feel like he can cut much more from that in the context of a public health crisis. And school aid is the other huge program in the state budget. And then in addition to that authority, he has, during the year, he's supposed to report, he and his budget director are supposed to report on how revenues are coming in and how spending is going out and how far out of balance things are. And if necessary, there may be further rounds of cuts as the year unfolds. So there's an extraordinary level of uncertainty, an extraordinary amount of authority vested in the governor to manage that uncertainty. There's also, he's been given $11 billion in borrowing authority, some of which he will be needing just to manage cash flow. The state's expected to run very, very low on cash in the near future because it has to pay school aid payments. And so they're going to use some of that borrowing authority to manage cash flow, and some of it probably just to get through the year.
So I understand that we do have a question from our viewers. I think it will come up on screen. Can you see that the question is, do you have any information about the Heroes Fund?
I know that there have been proposals to establish a fund. I know the governor's talked about it. I believe he intended it for it to be a federal fund. And the idea of that is that there should be, the government should compensate frontline workers who are injured or even lose their lives as a result of this crisis. It's modeled on a fund that was set up after 9/11. I don't believe there's much more to be said about it than that. It's an idea at this stage, as far as I know. I don't know that it's been fleshed out in legislation at all.
Well, we'll have to keep our eye out, on that. Another question: how do you see hospitals and healthcare providers adapting to these budget cuts?
You know, the healthcare industry, I mean, everybody has been kind of turned upside down by the situation, but no part of the economy has been more affected than the healthcare industry. And it's not, in the New York City area, it's one type of crisis. It's a wave of very sick patients who need intensive care, and all too many of whom die. And it's putting immense physical and emotional pressure on employees and financial pressure on the hospitals. And then when you move away from the epicenter of the crisis and you get into upstate New York, hospitals were under orders to stop doing elective procedures because so they would have room for a wave of patients. But that wave of patients really has not come upstate. And so hospitals are, empty of patients and starving for revenue, and they're laying off, or furloughing, I should say, thousands of their workers. Doctors are conducting their business almost entirely by telemedicine, some of them. They're not seeing as many patients as they're used to, and that has an effect on their revenue. Insurance companies are they've been instructed not to, like, if people don't pay their premiums, especially if employers don't pay their premiums, insurance companies have instructed to give them a grace period, and they're being urged to kind of prepay money to hospitals and other providers to keep them afloat in the crisis. And then there's the whole unemployment situation. A lot of people's health care is tied to their employment. Millions of people are losing their jobs. A lot of them, if not all of them, are losing their health insurance in the process. The turmoil in this part of the economy is really significant. There are tens of billions, if not hundreds of billions of dollars on the table to try to address some of those problems. But it's very unclear to me. I don't think anybody can be sure that that's going to be enough to make things whole when all is said and done.
So I guess, Bill, we're so focused on our area, which, as you've said, is the epicenter and, kind of the belly of the beast. But in terms of some of the other areas of the state, I know that I believe the governor did say that some of the hospitals upstate now can start having some elective surgeries based on, their level or non-level of COVID patients. How do you see that rolling out?
I'm sorry, I lost audio there for a second. What was?
Oh, so I was just mentioning how, it's a very different picture here in Westchester in the metro area. We're still very much consumed with, the current conditions and crises. But upstate, I guess, and further all the way upstate, things are different. And the governor, I believe, has started to allow some of the upstate hospitals to start performing elective procedures.
Yes. Yeah, he's told hospitals that at the end of this month they can start resuming elective procedures under sort of limited conditions. They have to verify that the patient is not infected. They have to verify that they have enough. They have to leave some beds empty as kind of in case of emergency. So there's going to be kind of pent-up demand. These are, we call them elective procedures, and they're non-emergency procedures, but some of them are kind of necessary and important, and they have to happen eventually. And so there's going to be kind of a backlog going forward that will probably continue for months of procedures that have been delayed and the hospitals are playing catch-up on. That is one of the signs of kind of a thaw in the shutdown. The governor recently said that golf courses could reopen on kind of a limited basis, with a rule that, like, people have to stand far apart from each other. Marinas are going to be allowed to open on a limited basis as the weather gets warmer. People are wanting to go out on their boats. I think you're going to start to see, and the governor's made this pretty clear, he's going to start kind of following how well each area is doing in terms of controlling the virus. Upstate in general has a much lower level of virus, and so it'll probably start in some of the more remote areas of the state. But it's going to be limited. They're not going to just wholesale, from what I can tell, they're not going to just sort of say, everybody can reopen tomorrow. And frankly, even if they did say that, I'm not sure that the customers would go back. And I'm not sure, say, a restaurant that has a big crowded dining room, I'm not sure they would want to reopen, and I don't know that they would be able to fill that dining room under any circumstances. So it's going to be a slow process.
Yeah, that for sure. It's good. There's still a long road ahead of us. I understand we do have another question. What can you tell us about higher education funding, SUNY and CUNY, and/or the small funds that go to private colleges? It's somebody from Manhattanville College is asking the question.
I don't know a lot about that area. I know that some colleges and universities have drawn funding from some of the federal programs, but I also know that that it's been controversial, and I know that some of the very well endowed universities, Harvard in particular, has chosen to return the money because it became so controversial. But I know, there were programs, I don't know that they were specific to higher education, but there were programs that were meant to support businesses and organizations, and universities have to some extent been able to draw on those.
Yeah, I'm sure that's going to be an area that will get a lot more attention as we go forward. So, Bill, as we kind of come towards the close a little bit, I was wondering if maybe you could kind of just share some thoughts about a road forward. I mean, you've been studying this industry for a lot of years. Obviously, nothing's ever happened like this before. As you talk to healthcare providers and other key stakeholders, any sense of what we're going to look like, quote unquote, on the other side?
There is going to have to be a reckoning. Maybe reckoning isn't the right word. There's going to have to be an analysis of what happened here, how it got so bad, and what steps could be taken to prevent something like this from getting so bad again. And I think a lot of it is going to involve changes in the healthcare system. Some of it will be public health, so it'll be better surveillance and stuff like contact tracing. But also, I think there's, as we saw sort of painfully, one of the crucial things, if you're going to try to manage an outbreak, one of the crucial things is infection control. That's why we've been washing our hands and wearing masks. Well, in no part of the world is that more important than in the healthcare system. And we got caught short of the basic equipment needed to manage infections in hospitals and in nursing homes, and even in ambulances. When EMTs show up on a scene, they need to be protected. And that there should be, going forward, and maybe there should have been already, just a significant stockpile of that type of equipment in anticipation that there will be times when we need a whole lot more of it than usual. And this was one of those times, and we ran out. And there just aren't enough manufacturers in the world to make the equipment that was needed. And a lot of them are in China, which became awkward. So I think that'll be I think they will review the quality of our infection control procedures and the availability of the equipment and the ability to surge those supplies and other needs when an outbreak is coming. And really, I think there should be an emphasis on catching it early and controlling it early so that we never get to the point where we're dipping into those stockpiles. The ideal situation would be to have a very deep stockpile of equipment and then never use it.
Well, hopefully, if nothing, we've learned some important lessons. There was a follow-up question to the one from Manhattanville. I meant education funding in the regular New York State budget, I guess for higher ed. Is there, do you have any insights as to that?
Okay. Again, that's not an area I follow closely. As I said before, this was kind of a business as usual budget. So sort of on paper, as the education funding for higher ed and secondary ed and primary ed didn't change dramatically. I know there was an increase in school aid. I don't know what happened to the SUNY budget or the other higher education budgets, but I don't think those numbers are really worth the paper they're written on because they're just not sustainable. Every part of the budget is going to be under pressure. Because when you lose 10 to 15% of your revenue, you have to cut everywhere, and I don't think it's likely that higher ed will be immune to that. But it's really impossible for anyone other than a very small number of people in the state government to anticipate where they will cut first. And even those people don't know how deeply they will need to cut until they have better information about what the federal bailout looks like, and what happens to the economy.
Yeah, well, I guess we're going to have to wait a little longer to see where a lot of these numbers shake out and what kind of funds we get from Washington, and how the crisis plays out as well. Hopefully, things will start to improve. I mean, we hear the numbers are improving, so hopefully we can get to the other side of it. So, Bill, again, any closing thoughts you want to share with us? This has been very helpful. I know there's still a lot of unknowns, and probably another couple weeks they might ask you to come back and update us as things play out. Just any final thoughts from you?
I mean, I guess I would just sort of echo what you said at the beginning and express appreciation and admiration for the really amazing work under extremely bad conditions that the healthcare workers in particular are doing. But then there's also a lot of other people who are keeping us fed and the trash collected and the power on, and they're also working under difficult conditions. And I think the numbers are showing that those people are seriously putting themselves at risk. The infection and fatality rates are higher in certain segments of the population, and one of them is among frontline workers. There are signs that, so for example, transit workers are seeing kind of a surge of infections, and so those people are doing their jobs and keeping our society running, even in this crisis, and we all owe them a debt of gratitude.
No, I totally agree. So again, I want to thank Bill Hammond for joining us. Of course, I'd like to thank again the WCA Platinum partners who make all of this programming possible, and we're very grateful for their support. And hopefully you will follow the WCA on Facebook, on LinkedIn, join our groups, and you'll find out more about upcoming video chats, and you can share resources. We have information on our website as well. So again, I want to thank everybody who tuned in, and a special thanks again to Bill.
It's been a pleasure.
Thank you again, everybody.